Hello, hello. My name is Jones, and today we are going to look at bipolar and unipolar mental health problems. Okay, so we are going to look at these conditions separately and make a comparison that exists between bipolar and unipolar. Okay, so in our discussion, we're going to look at bipolar, the cause, the symptoms, okay, that can be seen, and then we also look at the medical interventions that can be employed for each, and then the nursing intervention. Then after that, we'll also look at the same under unipolar, and then we make a comparison that exists between bipolar and unipolar. So bipolar results from disturbances in the areas of the brain that regulates mood. It involves periods of excitability, which is mania, and then this period alternates with a period of depression. Okay, so this condition may affect men and women equally, and usually appears between ages 15 to 25. The cause of bipolar is unknown or idiopathic, and the other related cause of bipolar is that it may occur more often in relatives of people with bipolar disorders. So there is some genetic predisposition to bipolar. Okay, though the cause of bipolar disorder is not necessarily known. So what are some of the signs and symptoms of bipolar disorder? So to appreciate the signs and symptoms of bipolar disorder, we need to know that in bipolar disorder, there are two phases. There is the manic phase and there is the depressed phase. So in manic phase, we are going to see signs and symptoms of mania, and then in depressed phase, we are going to see signs and symptoms of depression. So in manic phase, the signs and symptoms include agitation or irritation. We are going to have elevated mood. Okay, by elevated mood here, we are saying there is hyperactivity, increased energy, and lack of self-control. Okay, here the individual has racing thoughts. Then the other signs and symptoms seen in the manic phase include inflated self-esteem. Okay, so in inflated self-esteem, the individual may have delusion of grandeur. They may have false beliefs in special abilities. So we see this in the manic phase of bipolar disorder. So they may have insomnia, or there is little need for sleep, that is in the manic phase. There is over-involvement in activities, or there is hyperactivity. There is poor temper control in manic phase, and patient may be reckless or show reckless behavior. This reckless behavior may go with binge eating, drinking, or drug use. You may also see impaired judgment or sexual promiscuity. Okay, or this patient may have spending sprees, with a lot of money going to do a lot of shopping because of this manic phase. So they may go on some kind of shopping, spending sprees abnormally, okay, because of the reckless behavior. Okay, so in the manic phase, we also see the tendency to be easily distracted because of hyperactivity of the patient. Okay, so in bipolar disorder, we say there's the manic phase and there's the depressed phase. So in the depressed phase, there is difficulties in concentrating, remembering, or making decisions. There will be eating disturbances. There will be fatigue or restlessness. There may be feeling of worthlessness, hopelessness, or feeling of guilt. There can be loss of self-esteem in the depressed phase. There can be sleep disturbances. Patient may also have suicidal thoughts, or may have withdrawal from activities that were once enjoyed by this same client. So these are some of the depression signs and symptoms that we see in the depressed phase of bipolar disorder. Okay, so what are some of the treatments that you can give in bipolar disorder? So treatment starts with the good investigation. So you take a proper history, and also observe the patient as you are taking the history. Then you can give antipsychotic medications such as lithium and mood stabilizer. And also for the depressive phase, you can give antidepressant. Then you can also do electroconvulsive therapy to control the abnormal triggering within the CNS that will help stabilize the mood of the patient. Okay, so some nursing intervention for bipolar disorder include providing a calm environment, giving a health teaching about regular exercises and also proper diet, and also explaining to the patient that getting enough sleep helps to maintain a stable mood. Okay, so these are some of the things in the study that we can look at in terms of bipolar. Okay, bipolar disorder or bipolar disorder, as we are looking at bipolar disorder and unipolar. Okay, so now to do with unipolar, okay, unipolar disorder is another name for major depressive disorder. So when I talk about major depressive disorder, we are looking at unipolar. So this occurs when a person experiences the symptoms for longer than 2 weeks of depression or depressive phase. Okay, so the causes of unipolar disorder, okay, can be grouped under biopsychosocial model. Okay, and in the biopsychosocial model, it proposes that there are biological, psychological, and the social factors that play a role in the causing of depression or causing of unipolar as a disorder. Okay, so apart from the biopsychosocial model, okay, which proposes that there is the biological, psychological, and social factors that lead to unipolar disorder or depression, there is also a diathesis stress model, which specifies that depression results when pre-existing vulnerability or diathesis is activated by stressful life events. Okay, so what are some of the signs and symptoms that we can see in unipolar or major depressive disorder? Signs and symptoms include depressive mood, a lack of interest in activities that the person might normally have had that the person might normally be enjoying in the past, so they will lose interest in that. Then there will be changes in weight and sleep pattern. There can be fatigue, or patient will feel fatigued most of the time. Then there is feeling of worthlessness and guilt. There will be difficulties in concentrating, and the patient may have thoughts of death and suicide. Okay, so these are some of the signs and symptoms of major depressive disorder or unipolar disorder. The medical intervention includes antidepressants. So when talking about antidepressants, you can give tricyclic antidepressants, you can give monoamine oxidase inhibitors, you can give selective serotonin reuptake inhibitors as some of the 3 groups of drugs that you can give in major depressive that is in major depressive depression or unipolar disorder. So you give TMS, that is tricyclics, monoamine, and selective serotonin reuptake inhibitors. Okay, then in treating major depressive disorder, you may also use electroconvulsive therapy. Okay, so now, what are some of the nursing interventions that you can do in unipolar or major depressive disorder? So you can do interpersonal therapy, you can do psychotherapy, you can also encourage the clients to have regular exercises, you can do cognitive behavioral therapy, and you can also do behavior modificational therapy. So these will help you to come up with a nursing care plan for your nursing care by ensuring that you tackle some of these things or within this framework. Okay, so now let us differentiate between bipolar and unipolar disorder. So in our differentiation, we are going to look at following characteristics in terms of gender and age of onset. We'll look at it in terms of sleep pattern, how the disease affects sleep pattern. Then we'll look at it how the disease affects appetite. We'll look at it how the disease affects the activity level, also how the disease affects the mood. So in terms of gender and age, and age of onset. Unipolar affects women often than men and appears later in life. So for unipolar, you're saying it affects women more often than men. Then bipolar affects men and women equally, and the average onset of this bipolar is 18 years. Then in terms of sleep pattern, how the disease affects sleep pattern. Okay, in unipolar, we see generally insomnia, which is difficulties in falling asleep, or repeatedly, the patient may be waking up repeatedly during the night. Then for bipolar, generally, here what we see is hypersomnia, which is excessive tiredness and difficulties waking up in the morning. So in terms of sleep pattern, in unipolar, we see insomnia, okay, that is difficulties in falling asleep, or patient may be waking up repeatedly in the night. That is in the unipolar. But whilst in the bipolar, we have hypersomnia. Patient does not necessarily want to wake up in the morning. They want to sleep throughout. They want to continue sleeping. Then in terms of appetite, in unipolar, patient often has loss of appetite and diminished interest in eating. When you talk of bipolar, there is often binge eating and craving of carbohydrates that may alternate with loss of appetite. And then in terms of activity, when you look at unipolar, the patient is agitated. Pacing and restlessness are more common in unipolar. Whilst in bipolar, there is inactivity, somnolence, a slowing down of movement. Okay, that is, we necessarily see psychomotor retardation, okay, to be more common in bipolar. So in terms of activity, okay, in unipolar, there is agitation, restlessness, whilst in bipolar, there is psychomotor retardation. Then in terms of mood, in unipolar, there is sadness, hopelessness, and feeling of worthlessness. Whilst in bipolar, we can see almost the same situation as unipolar, but in bipolar, patient may not have the guilty feeling as prominent as we can see it in unipolar, or in the patient who has major depression. Okay, so in unipolar, also something to note is that episodes often last longer. Sometimes the unipolar is more responsive to treatment. Okay, sometimes it's more responsive to treatment. Whilst bipolar, there might be risk of drug abuse and higher suicidal ideation that we might see than as compared to unipolar or major depression. So there you have it. Today we have been looking at bipolar and unipolar disorder as some of the conditions in mental health. Okay, so bipolar disorder, which is a condition that we see in which there is a mix of mania and depression. And when talking about signs and symptoms, we said there are manic symptoms and depression symptoms, because there is the manic phase and depression phase. In terms of treatment, you look at the treatment that you use in mania, and you also consider the treatment that you give in depression. Nursing intervention, based on the signs and symptoms that are in mania and those that you see in depression, then you can draw up a nursing care. Then unipolar, which is another name for major depressive disorder. Okay, this one occurs when a person experiences symptoms that is for longer than 2 weeks of depression state. So they have a unipolar disorder now. So the causes, okay, for unipolar are biopsychosocial, can be classified under biopsychosocial model, and also can also be gotten from the diathesis stress model, which tries to specify the depression, which tries to specify that depression results when pre-existing vulnerability or diathesis is activated by stressful life events. So when talking about signs and symptoms, it's necessarily signs and symptoms of depression. And in terms of medical treatment, when you're treating medical major depressive disorder, you give 3 groups of drugs. That is, you give tricyclic antidepressants, monoamine oxidase inhibitor, and selective serotonin, the uptake inhibitors. Then you can give other antidepressant drugs and also do electroconvulsive therapy. Then after all this, then we made a comparison of bipolar and unipolar. So from me, I'm saying thank you and keep studying.